I'm a stem cell transplant coordinator. We work up patients with multiple myeloma, leukemia, lymphoma. We work them up for stem cell transplants and cellular therapies. I chose oncology because my dad battled cancer a few years ago, and he made it out on the other side, but I just remember my family being so confused on who to call, when to call, what appointments meant, and I wanted to help other families get that clarity and really understand their cancer journey. During my free time, I do triathlons. I would say my favorite part of the triathlon is finishing, but I think my favorite part is swimming. I got into triathlons during the pandemic. When all the gyms were closed, I started to run, and then running got kind of boring. So I was just kind of Googling things to do outside, and triathlons came up, and I knew that there was a body of water that I could swim in nearby, and I signed up for the Baltimore Triathlon in October of 2021, and I was like hooked after that. In September, I have IRONMAN Maryland, which is what they consider a full Ironman, which is 140.6 miles. What goes through my mind when I'm in the midst of training, like some of my bike rides are upwards of 5 hours long, and really what goes through my mind is, why am I doing this? And sometimes I think about patients that I've taken care of in the past that used to do triathlons and they can't do them anymore. So when I'm feeling really lazy and I'm like, I don't know why I'm doing this, I think about those people, and I think about really not to take my health for granted. It is an individual sport, but at the end of the day, it's a team that gets you across the finish line. If you're a part of a triathlon club, they're the ones, willing to come out with you on a Saturday morning at 6 a.m. to ride your bike for 5 hours. Being a triathlete has taught me patience, which I don't have a lot of. You're not gonna get better at biking overnight or swimming or running. It's something you have to work at day in and day out. It's fun to see over the years your finish times decrease. So that's one of my favorite parts, is watching yourself get better. I think that being a triathlete makes me a better stem cell transplant coordinator. After training in the morning, it really just calms me down, and I can approach any challenges that my patients are facing in a much calmer fashion with a clear head.